Hey guys, Dr. Renato here, Well Chiropractic. Today we're doing our part number 2 of the degenerative disc disease video that we did just recently. Last week we talked about what is degenerative disc disease, and today we're going to talk about the cause and what we can do about it. Because something has to happen. There's got to be an explanation to why does the body go through that process. Some people think that it's inevitable, it's going to happen regardless. So I want to walk you through a couple things that will give you a further explanation of what's happening. So remember our diagram that we did the other day here of normal anatomy. Here we have good disc height. We have the thin disc, which is also known as degenerative disc. So what I want to do is I'm going to draw you a picture of this healthy disc, kind of a top-down view. So we're going to start with inside, in the middle, in the center of that disc, there's a jelly-like substance called the nucleus, kind of like a marble, and that's really tough. A thing inside, and then around it we have these rings. Okay, these fibers, and they're really tough too, kind of like the rings of the tree. So the disc, like we said the other day, it gives the spine its shape. It acts as a shark absorbent, and it also protects this hole right here where the nerve comes out of the spine. So it's a pretty tough structure. So what happens is that over time, you know, and people always ask me, like, okay, who are these people that are coming in? Are they like, you know, just construction workers, or is it like a big injury, a car accidents, or something like that? I said no. Most of the folks that come in for chiropractic care and they are dealing with things like that are just like average office workers, just people that sit all day long. So something has to happen, right? And in order for me to explain that, I'm going to use my friend's spine here. So our spine has to be fluid and moving. All the joints have to be able to turn and twist and move properly. And when they don't, when they lock up, what happens is the vertebrae go out of position, and that starts that basically degenerative process, because there's no movement in that joint. So over time, like if you think of simple physics, if you don't use the joint, you're going to lose it. So over time, what starts to happen is that there's little micro tears that happen here inside this disc space. Okay, and then of course the body tries to fix that by increasing inflammation. So then it turns into scar tissue, right? So it's no longer as stable as it should be. It's not able to do its job like it should. So but here's the thing: most of the time you don't have any symptoms. That, you know, in this stage, when this starts to happen, these little micro traumas, like from bad posture, just sitting at a desk for a long time, most people are not symptomatic, so they feel fine, is what I hear. I feel fine, I'm okay. So at this stage, when this is happening, you don't feel anything, but eventually the body is going to realize that there's instability. So then it's going to start to kick in and ask the muscles to like support the spine, and then you're going to feel some aches and pains. So you know, I want you to know that 4 things that we can do, that you can do to prevent stuff like degenerative disc disease. So number 1, it's not inevitable. It's not something that's going to happen to you as you age. I totally disagree with that. It's something that can be prevented because we see it in people that are older and younger, so it's really not age specific. Number 2, in this early stage, when the disc starts to do that, from lack of movement in the spine, the disc gets these little micro tears from the micro traumas, repetitive things at work or posture. There is no symptoms. Okay, so we want to note that. Number 3, kind of a DIY, is you got to get the spine moving, right? So we as chiropractors, we find out which joint is out of alignment, and we put it back in its place, get the spine moving again, allow the nervous system to function properly. And then number 4, I would say, remember number 2 again, that there is no symptoms in early stage. And most people, like I said, they say, I feel fine. But in fact, what's happening is that these little micro tears are here, just tearing up the disc, and it's losing its hydration because a lot of what's inside is water, and then they begin to do this. They start to shrink up, and they start to the bones start to try to fuse to one another through the bone spurs here. So you know, that's our job really as chiropractors, to get the spine moving, keep you healthy. Like I said, think of simple physics rules, is that if you have something that's not moving, you're going to lose it. If you have a muscle you haven't worked out in a while, you're going to lose that as well. So we want to keep the spine healthy, get motion fluid back into that spine so that this can stay hydrated and healthy, and support support the spine, give it shock absorbency, and protect the spine and the nerves that come out of that. So hopefully you guys found that helpful. If you do have any questions, feel free to post down here, comment or ask questions. You know, if there's things I can help you with, I will definitely try. If we don't, we'll find somebody who can help. So thank you guys so much for watching, and we'll see you next week.